Hi, my name's Chad, and I'm addicted to cheeseburgers and alcohol. So hungry. That pain is back. Right in my right upper quadrant. But if there's one thing I love more than cheeseburgers, it's my boyfriend Calvin. Strike up the band and make the fireflies dance, silver moon sparkling. But lately, we seem to have hit a little bit of a rough patch, and my alcoholism has gone out of control. I came in like a wrecking ball. I never hit so hard in love. All I wanted was to break your walls. All you ever did was wreck me.
So what's new with you?
Stomach hurts.
Does that hurt?
Yeah, it really does.
I think you need to go see the doctor.
Yes, ma'am.
All right.
Come on in.
Hello, Chad.
How are you doing?
Good, how are you?
I'm alright. I've been better.
Okay, well my name is Yolanda.
Nice to meet you, Yolanda.
I'm your nurse today.
Okay.
Looks like your blood pressure is 130/90. That's a little high. Take your temperature. Ooh, 100.9. Do you feel a little warm?
A little bit.
So tell me a little bit about your family history.
Well, my family's got a little history of, obesity. I call them little apples. They just kind of bounce around. We've got hypertension, elevated cholesterol. I guess that's about it.
And are you currently taking any medications right now?
Well, I'm on Zoloft for my depression, and I'm currently on estrogen replacement therapy.
Any family history of gallbladder issues?
My mom did have gallstones one time.
Did she have her gallbladder removed?
She did, as a matter of fact.
Do you have any issues with indigestion, heartburn, nausea, and vomiting?
Ooh, let me tell you.
How often do you get nauseous?
Every evening around 7 o'clock.
What about your heartburn?
It's around 7:13 that starts kicking in.
Are there any triggers?
Extra large pizza and the donuts I eat for dinner.
Tell me about your bowel movements. Do you notice discolored stool or dark urine?
My urine typically looks like my cup of coffee in the morning. Pretty dark. Bowel movements are, well, I like to describe it as like ground turkey mixed with olive oil.
What color?
Ray.
Okay.
Ish.
Your chiefest complaint for coming in today, was it pain? Can you show me where?
Right here in my abdomen.
I'm going to go ahead and have you lie down for me. I always want to listen first before I palpate. Just relax for me. And you said your pain was up here?
When you lifted your hand off, that's when it hurt.
What kind of pain? So sharp?
Yeah.
Okay.
Only when you lift it off, though.
Okay, and I'm going to do it on this side and tell me if there's any pain.
Nope. Nope.
Alright, Chad. You can sit up.
Okay.
Dr. Anderson should be in just a few minutes.
Okay.
Can I get you anything?
Nope.
While you wait?
That'll do it.
Okay. Hello, Chad. My name is Dr. Aniston. I'm going to be taking care of you today. How are you?
I'm doing okay. I have a little pain.
Okay, and what is the intensity of that pain on a 0 to 10 scale?
Right now it's about a 9, especially after I eat.
Where is that pain? Can you show me?
Right in my stomach.
Okay, so your upper right
Yeah.
quadrant. Got it. Tell me about your diet.
I usually eat out 3 or 4 times a day. My boyfriend and I don't like to cook very much.
You have a boyfriend?
Yes, I have a boyfriend. His name's Calvin. He's wonderful. He's the light of my life.
Oh, okay. Do you consume alcohol? Okay, I'm just gonna, yeah. So it sounds to me like you might have gallstones, otherwise known as cholilithiasis. So what we're going to do is we're going to do an ultrasound on you to confirm that. Alright, Chad, this is going to be a little cold. The ultrasound came back positive. We did find some gallstones in your gallbladder. And your labs also came back and showed elevated liver enzymes as well as elevated alkaline phosphatase and bilirubin in your blood as well as bilirubin in your urine, which are all indicative of cholilithiasis. So normally when we have cholilithiasis with cholycystitis, which is inflammation of your gallbladder, we do a laparoscopic cholecystectomy. It's a surgical procedure where we make several small puncture wounds in your abdomen. We go in with a laparoscope, which has a camera on it, so we can visualize your gallbladder, and we go ahead and remove the gallbladder.
Won't I need that?
Actually, you'll be okay without your gallbladder. Your gallbladder is a small organ located underneath your liver, which stores bile that your liver creates, and it helps in the digestion of fat. So when a gallstone blocks the flow of bile from the bile duct to the intestines, it can cause infection and serious abdominal pain. So you'll just need to make a few modifications to your diet after the surgery and your lifestyle, but other than that, you should be okay without it.
Sounds fantastic.
All right. Well, we'll go ahead and prep you for surgery.
Where's my nurse?
Chad? Hi, Chad. How are you feeling?
I'm in a lot of pain.
Well, where's your pain?
It's kind of up here and here.
During your surgery, they did fill your stomach up with some carbon dioxide so that they can see that gallbladder. So that pain in your right shoulder, that's the gas escaping from the gas pocket, and it's traveling all the way up to your right shoulder. So I'm going to put you in a different position, and this should help with that. It's called
left lateral sim.
Go ahead and hold on right there, okay?
Okay.
And then turn on your side.
Okay.
You should be feeling a little bit better.
That feels much better.
Okay.
Can I have my cheeseburger now?
Oh, I'm sorry, but right now it's only a clear liquid diet. Can I get you a Sprite maybe, or some water?
A Sprite would be nice, thank you.
Well, in a little bit, I want to get you up and walking. The earlier we ambulate you, the better. Well, I'll be back in a little bit with that Sprite.
Where's my Sprite?
Hey, Chad.
Oh, hey, Yolanda.
I'm just coming back to see how you're doing, and I got your Sprite.
Thank you.
Oh, you're welcome. So how's your pain now?
About 7.5.
Well then, I'm going to go get you some pain medications, and when I come back, I'll show you some breathing exercises, and maybe we can go for a walk.
That sounds lovely. Where's my pain meds?
Hey, Chad. So here is your Toradol. Should help with the pain. Alright?
Hook her up.
So I'm going to teach you some deep breathing techniques to help with your pain. I'm going to sit you up. So I want you to take a deep breath in through your nose. And when you exhale, I want you to cough a few times. Good job. Now if you keep doing that, that should help with the pain. Looks like your pain medications are done infusing.
Okay.
We're going to get you up and walking. I want you to take it easy because this is your first time ambulating since surgery.
Okay, you gonna help me?
Yes.
Okay.
Okay, don't let these empty halls scare you.
Okay.
How are you feeling?
Feeling okay.
Do your deep breathing as well.
How's that?
Perfect. Good job. Let's go back to your room. Hi, Chad.
Hi.
Feeling a bit better?
I feel so much better. Thank you.
The doctor put in an order for discharge.
Okay.
So I'm just going to go over a discharge plan with you. Are you ready to learn, Chad?
I'm ready. Let's do this.
All right. How do you learn best?
Well, I like discussion. I like some reading material, but not too much.
You have some bandages
That's the bandages.
right next to your belly button. You can remove the bandages tomorrow. It'll probably be easier if you do it in the shower. Be sure you wash that incision with antibacterial soap and obviously water. Now here are some things that we want you to look out for, and if they do occur, please call the doctor. If there's any swelling, pus, discharge, redness on your incision, or severe abdominal pain, nausea, vomiting, fever, chills, you give Dr. Aniston's office a call.
Okay, I got it.
Okay. You can return to work in a week. Do you work?
Yeah, I work at 5 Star.
Try to start a diet consisting of
Low fat.
high in fiber to help you go, number 2, and calcium. The best thing you can do right now is to eat healthier. Cutting back on that alcohol intake and the cheeseburgers, pizza, donuts. Might want to eat lots of fruit, lots of vegetables, lean proteins such as chicken, fish.
Okay.
Do you like to exercise?
I think it might be a good thing to start doing.
Is your significant other here with you?
I think he's at home. I'm not even sure. We're not even really together anymore.
I do have his contact number here. If you like, I can give him a call just to give him a heads up on your new lifestyle modification.
I guess. It'd be better hearing it from you than me.
Yeah.
He can't punch you, so.
Oh.
Great.
It was great working with you, Chad.
Thanks, Yolanda.
Chad suffered from gallstones due to his poor diet high in saturated fats, his chronic alcohol consumption, and his family history of cholilithiasis with cholycystitis. Common surgical procedures used in the treatment of cholilithiasis with cholycystitis include ERCP, endoscopic retrograde cholangiopancreatography. That's a mouthful. ERCP allows us to see the common hepatic duct, the common bile duct, and the cystic duct. It also allows us to take samples of the bile to see what kind of infectious organism may have caused the cholilithiasis. ERCP also allows us to get rid of the gallstones. In Chad's situation, we decided that a laparoscopic cholecystectomy was the best option due to his family history. A few interventions used with cholecystectomy include management of infection with the use of antibiotics, pain control with NSAIDs or morphine, and fluid and electrolyte maintenance. 1 week post-operatively, we usually have the client come in for a follow-up session. Speaking of which, Chad, how are you feeling?
I'm feeling great, Dr. Aniston. Thank you.
Good. Well, your labs have all come back normal,
Okay,
so
good.
that's good. How have you been doing with your diet and your lifestyle changes?
Well, after Yolanda referred me to the battered men's shelter of Reno, it really helped me turn my life around. I was able to stop drinking, kicked Calvin to the curb.
Now, what have you been including in your diet?
I try and eat a lot of vegetables, high fiber, leafy greens, lean meats, a lot of water, as always.
Very good, Chad. Well, it sounds like you're doing great, so I'm really glad to hear that.
Thank you.
For more information on cholilithiasis and cholycystitis, please refer to your medical surgical nursing book on page 1036. Did you read?
find my